Okay, so good afternoon. My name is Luke ARLETA, your student nurse from the Kalayan Educational Foundation Incorporated, and today I will be demonstrating to you the assessment of the head-to-toe assessment. Yan, the head-to-toe assessment. So the purpose of this assessment is to conduct a 5 to 10 minutes or siguro pwede na rin 15-minute assessment of the adult patient's head up to the toes. And also to know and differentiate the normal with the abnormal findings, and to know the nursing responsibilities needed in the patient assessment. Okay? So for the equipments, I will be using a stethoscope. Yeah, stethoscope. And I'll be using otoscope for the ears. And I will a pen light. And I will also have a tongue depressor right here. Assuming that it is a tongue depressor. And I also have personal protective equipment such as gloves and face masks. And gowns and face shields are optional. Okay? So now I will begin with the preparations of the equipments needed. So as you can see, I have already prepared my equipment ahead of time to facilitate organized assessment and to avoid the loss of time. And I will greet and identify my patient. I will introduce myself, and I will explain the procedure. So, good day. My name is Lucas, your student nurse, and I will be conducting a head-to-toe assessment to you, and I would like for us for consent and cooperation with the procedure. And and may I ask you your name and your birthday?
Kailangan pa yung birthday.
So, I have collected the patient data, and now I have explained the procedure, which will reduce the anxiety of the patient and facilitate cooperation and compliance with the procedure. Facilitating compliance with the procedure. And now I will start by positioning my patient in a sitting position already, and I will inspect the head. First, I will inspect the head. Note for any contour or symmetry of the head, the face. I will palpate, inspect the hair. Note for the distributions. Note for any skin lesions on the scalp. Okay. Panin. Yan. Okay. Note for the distributions. Note for any abnormalities or deviations. Note for any note the texture of the scalp, if it is scaly or moist. Ganun. And okay, the hair is in a normal condition, and the head is also in symmetry. Has symmetry. Yeah. Asymmetry, okay? And now I will inspect the face of my patient. I will inspect the skin, if there are any skin lesions, any redness, or any papules or macules or any kind of skin lesions. Okay, so there are some papules on the forehead, but that is not that is normal for her age. And so I will instruct my patient to perform several facial expressions. Ma'am, can you smile for me? Can you frown? Okay. So a good indicator for the symmetry of the face is yung nasolabial folds, which are the folds on either side of the face. Okay, so that is a good indicator of the facial symmetry. Okay, now I will assess the eyes of my patient using the pen light. Yeah. Okay. Okay, so note the color of the eye, the sclera, and the conjunctiva for any swelling, discharge, or redness. So my patient's eyes are in the normal condition with no redness or swelling whatsoever. Okay. So I will now assess the nose. I will inspect. I will inspect each nostrils separately. Yeah. So note any discharge or swelling within the inside the nose. Yeah, to check for the.
Pakitanggal kung meron.
So I note that the nose is in the normal condition. The nose is very clean. Okay. So now I will inspect the mouth using the pen light and tongue depressor. Please say ah. And so I will inspect. I will note for the color of the mouth, the gums. I will check for any damage in the mucosal lining. Okay, so the mouth, the color is pink, which is normal. There are no damage or lesions on the mucosal lining. There are no mga abnormalities whatsoever. Now I will inspect the neck. I will move behind the patient and I will inspect if there is any damage on the skin. I will also check the thyroid gland. I will palpate the temporomandibular joint for any swelling lymph nodes. I will check for inflamed lymph nodes on the temporomandibular joint. I will also check for any crepitus or popping sounds. Okay. So there are no swelling lymph nodes for my patient. And I will palpate the thyroid gland. Okay. Okay. There are no crepitus also. And I would instruct my patient to move her neck back and forth and side to side for the movement of the neck.
Ching.
Excuse me. Okay, so the neck is in the normal condition. There is no pain when on movement of my patient. Okay. So next is I will inspect the chest and the lungs. Okay. I will inspect the skin around the chest, the anterior and posterior side, so there are no skin lesions. No, I will note for the color. I will note for any color of the skin, and I will check for the chest expansion by using the diaphragmatic excursion by placing my hands behind my patient like this. Okay. I will note the expansion. I will instruct my patient to inhale, exhale. Okay. Inhale, exhale. Okay, so the normal diaphragmatic expansion is 3 to 5 centimeters, but it can also increase to 7 and 8 depending on my patient if he or she is well conditioned. And now I will auscultate for the lung sounds. If there are any adventitious sounds within the lungs. So inhale, exhale. Okay. Inhale, exhale. Okay. So there are no abnormal sounds in the lungs. Okay. The patient has normal lung sounds. So there are 3 types of normal lung sounds. Those are the bronchial, bronchovesicular, and vesicular lung sounds. Okay. So next is I will inspect the breast. Inspect for any swelling, dimpling, or discharge on the breast, and there is nothing present, any abnormal presence in my patient's breast. And I will now auscultate for the heart. I will locate the apex of the heart using I will place the diaphragm of my stethoscope on the apex, and I will listen for any. I will note the rate and rhythm of the heartbeat, and note for any regular or irregular heartbeat. I will do this for 1 full minute.
Jimmy.
Okay. So, I have auscultated my patient's heart, and
Me.
it is in the normal condition. There is no irregular heartbeats whatsoever, and the rate and rhythm is normal for her age. And yun nga, I forgot to mention nga pala, when doing the when assessing the eyes, we need to also do the visual acuity. When we test for the visual acuity, we use the Snellen's chart. So assuming that I have already done the Snellen's chart right here, yeah. We use the Snellen's chart for the visual acuity, and when we are assessing the ears, we also conduct the whisper voice test for the hearing acuity. It is when we stand behind the patient 1 to 2 feet apart and whisper something like 9-4, and the patient will confirm if he or she has heard it. Okay. So next is I will now assess the abdomen of my patient. Higa ka dun, ma.
Naantok ako. Ay.
Higa ka dun.
Jimmy boy.
Okay. Yeah. I will now assess the abdomen of my patient. And I will also be using the stethoscope. Now, when assessing the abdomen of my patient, I will start with the right lower quadrant because that is where most of the sounds of the abdomen is heard. Okay? I will auscultate systematically, starting from the right lower quadrant, then to the right upper quadrant, then to the next, and to the next. I will do this also for 1 full minute, and I will note for any vowel sounds, regular or irregular. I will note them both.
No, Jimmy.
Okay, so there are no the vowel sounds is normal, and now what I will do is I will assess the upper and lower extremities of my patient. I will note the skin color, the temperature and texture of the upper and lower extremities. I will also assess for the capillary. I will test the capillary refill, and I will check for any edema present. Okay. On the toes, I will check capillary refill, and on the fingernails, yeah.
Uling.
Okay. So the color of the nails has returned quickly. So the blanch test is there are no problems in the heart of the patient. Okay. So I will palpate for edema. Okay, so there is no presence of edema. I will note that as seropositive. Yeah, seropositive.
Zero positive. Yung negative yun.
Oo nga. Seropositive. Okay. Tapos next is I will assess the neurological state of my patient using the Glasgow Coma Scale. Okay, so as you have observed in the video, my patient has spontaneous eye movement, which I will grade 4 in the Glasgow Coma Scale. Okay, so E4. And now for the verbal, as you can see, my patient has been speaking in the whole video, and she is aware of her surroundings. And with what we are doing now,
No.
what we are doing now. So I will grade that 5 in the verbal part of the Glasgow Coma Scale. And for the movement,
No. No, Jamie. Come here. Jamie.
okay, so I will note that in the chart. And for the for the movement, as you can see, my patient is. Can you flex your arms and legs for me? Okay. Okay. Yeah. Can you yeah? Yeah. As you can see, her movement is very very graceful. Okay. So I will grade that 6 in the muscle, the movement is, I will grade it 6 on the Glasgow Coma Scale. So, the NVS of my patient is E4, V5, and M6, which gives the score in the Glasgow Coma Scale a perfect 15 out of 15. Okay. Now, next is, ayun nga. Next is I will now position my patient in a comfortable position again. I will ask you to sit in a sitting position again right now.
Aray ka. Isang sa likod.
Hey, you go back here on your seat, ma'am. Okay. Okay, now my patient is in a comfortable sitting position again. Now, we are finished with our assessment from head to toe, and we will conduct again the proper hand hygiene to avoid, to reduce the transmission of microorganisms, and to take care of the equipment that we use for today, to facilitate proper care for the equipment, and to document the findings on a chart or record list for the evaluation for the evaluation or later use, or for when the doctor needs it in diagnosing my patient with whatever she has in her body. Okay, so now we are done with the procedure and the demo. I have been your student nurse, Luke ARLETA, and I will see you again. Thank you. Thank you.